Hi, I am Dr. Tamatmat, and for this session, I will be talking about hemostasis. At the end of this lecture, you will be able to describe hemostasis and the mechanisms involved, compare and contrast extrinsic and intrinsic coagulation pathways, and explain how they will lead to the common pathway, discuss the coagulation factors involved in each pathway. We will tackle a little bit of the role of the anticoagulants in maintaining blood flow, discuss some disorders affecting hemostasis, and lastly, describe the different blood coagulation tests. What is hemostasis? So, it is described as prevention of blood loss or prevention of hemorrhage. So, in the succeeding slides, we will talk about the mechanisms of hemostasis, namely vascular constriction, formation of platelet plug, formation of a blood clot, and the growth of fibrous tissue. So in this image, um, you can see that hemostasis will start syempre if there is an injury to the blood vessel. And then the succeeding steps will involve the steps I've mentioned, which are vascular spasm or vascular constriction, then leading to the platelet log formation, the coagulation pathway, and then the formation of the fibrin strands or fibrous tissue. So we will tackle each of those mechanisms one by one in the next few slides. As I've mentioned, there should be an injury first or trauma to the blood vessel before hemostasis is activated. So after an injury to the blood vessel, um, there will be contraction of smooth muscle leading to the decreased or reduced blood flow. It is said that this vascular spasm or constriction results from local myogenic spasm. The blood components also release local factors that is contributory to this constriction, such as thromboxane A2, and lastly, nervous reflexes itself will act on the blood vessel to constrict. But it is said that the primary contributor for the constriction of the blood vessels would be the local myogenic contraction. So before we move on to the next mechanism of hemostasis, which is the formation of platelet plug, let's first talk about platelets or thrombocytes. So the platelets, they're formed in the bone marrow from megakaryocytes. They don't have nucleus and they don't have the ability to reproduce. So normally we have about 150,000 to 300,000 units per microliter of platelets in our blood. So here in this image of a platelet, you can see that their cytoplasm contains contractile proteins. They have alpha granules, dense tubules that during later on in the hemostasis process, when the contents are exocytosed, they will release local contractile proteins such as actin, myosin, thrombostatin, the fibrin stabilizing factor, which are essential for the hemostasis to proceed. They have remnants of the endoplasmic reticulum. They also have a mitochondria for the production of ATP and ADP. Inside also of those tubules, they have growth factors. So all of these are important for the hemostatic function of the platelets. Then lastly, there is a glycoprotein covering on the cell membrane surface of a platelet that is actually used to prevent, or that is actually important to prevent adherence to normal endothelium for smooth flow of blood. So remember, the flow of blood normally in our system, it is smoothly flowing. So hindi naman siya basta-basta nagka-clot. So one important function of the platelet is to ensure that we have a normal smooth blood flow. But again, we will discuss later that this glycoprotein is also needed to cause adherence once you have an injury in the vessel wall. So now that you have a little bit of an idea about platelets and their role, we should now talk about the formation of platelet plug, which involves three A's. So we have adhesion, activation, and aggregation. So I've mentioned a while ago that normally platelets do not adhere to themselves kasi nga merong glycoprotein complex in their cell membrane surface. So possibly also there is a negative surface charge on both the platelets and endothelial cells. So both sila negative, they will not attract each other. So walang adhesion na mangyayari. But once there is an injury or damage to the vascular surface or to the vessel wall, the exposure of the collagen fibers will make the platelets adhere to it. So magkakaroon ng adhesion, which is mediated by platelet receptors belonging to the family of integrins. So for instance, this adhesion is strengthened by the binding of von Willebrand factor to glycoprotein 1B1A receptor. So once they are adhere with each other already, the platelets and the damaged endothelial surface, the adhesion will then cause platelet conformational changes. So yung platelet mismo, magbabago siya ng itsura. It can swell, it can have pseudopods, radiations from its cell membrane surface, and these conformational changes will lead to the activation of platelets because there will be intracellular signaling cascade. So this cascade or intracellular signaling cascade will cause release of the contents. There will be exocytosis of the granular contents from the dense storage granules and alpha granules present in the cytoplasm of platelets. So kanina I mentioned that these granules, they contain factors needed for hemostasis such as ATP, ADP, the von Willebrand factor, there's clotting factor 5, fibrinogen also is present. So once these factors are released, it will cause more activation of more platelets. So since nirelease ni si von Willebrand factor, so mas dadami siya to bind sa glycoprotein 1B1A receptor. So the release of these factors will cause more activation of platelets in such a way na mag-aggregate na all the platelets na nag-adhere to themselves. So, parang it's a cycle na mag-adhesion the platelets to the vascular surface and then mag-activate ng more platelets until such a way mag-aggregate na sila by themselves. So, aside from the activation of platelets releasing these granules, it will also cause a conformational change in glycoprotein 2B and 2A receptor so that it can bind with fibrinogen para mas mag-aggregate sila together. Mag-form sila ng bridges and activate and aggregate together. So at this point, the platelet plug that has formed is initially loose. Kasi nga, parang nag-aggregate lang sila and then just fibrin fibers yung nag-connect sa kanila. So later on, we will discuss how this plug is strengthened. So the third mechanism for hemostasis is the formation of a blood clot, which is a semi-solid mass composed of both platelets and fibrin. So the time it would need for a blood clot to form depends on the type of trauma. So if your trauma is severe, the clot will develop in about 15 to 20 seconds. But if you only have a minor trauma, it would take about 1 to 2 minutes before a clot forms. So within a few minutes after the clot has formed, it should retract. So, ibig sabihin, kailangan mag-compress pa siya. Along with this retraction, there is expression of its fluid called the serum. So, this process usually occurs within 20 to 60 minutes after mag-form yung clot. So platelets, again, play a necessary role or a major role in this clot retraction because they release procoagulant substances. If you remember, the fibrin stabilizing factor that will activate the platelet thrombostinin, actin, and myosin, basically the contractile proteins, to compress this fibrin meshwork into a smaller mass. So, the clot retraction is basically i-compress mo yung na-form mo na blood clot para lumiit siya. So, para lumiit siya, kailangan i-express mo din all the fluids contained or inside this clot. So, again, platelet is very important for this process to occur. So, for the next discussion, we will now proceed with the coagulation cascade. So here, chemicals called clotting factors will prompt reactions that will activate more coagulation factors to proceed with clotting or coagulation. So the three essential steps in this mechanism is number one, after the rupture or the damage to the vascular wall, it should lead to the formation of prothrombin activator, which will cause the conversion of prothrombin into thrombin. And then lastly, the formed thrombin will cause the conversion or will result into conversion of fibrinogen into fibrin. So on the next slide, you will see a short clip summarizing the events leading to coagulation.
At the site of vessel injury, the first platelets arrive to start sealing the wound. Simultaneously, the coagulation cascade with its various coagulation factors is activated. This involves two pathways, the extrinsic and the intrinsic pathway. Extrinsic activation begins with now exposed molecules of the vessel wall, such as tissue factor, which forms a complex with factor 7. Finally leading to the activation of factor 10. This factor 10A is the point at which the extrinsic and the intrinsic pathways of the coagulation cascade meet. The intrinsic pathway consists of various coagulation factors activating each other in a chain reaction. At its end, a complex with an additional cofactor is formed. This complex now activates factor 10. Since the two pathways merge at the level of factor 10A, this factor has a pivotal role in the coagulation cascade. Further down the cascade, factor 10A in combination with 5A activates thrombin and induces the so-called thrombin burst. One molecule of factor 10A can catalyze the formation of 1,000 molecules of thrombin. These large amounts of thrombin cause the further activation of platelets and the enhanced formation of fibrin. Fibrin then forms strands, making up the mesh that stabilizes the platelet plug in an arterial clot and holds together the red blood cells in a venous clot. It can be concluded that the central role of factor 10A in the coagulation cascade makes it a viable target for therapeutic intervention in pathologically altered blood coagulation.
the process of coagulation is complex, but it is initiated along two basic pathways. So the extrinsic and the intrinsic pathway, which will merge into a third pathway known as the common pathway. So all of these pathways are dependent on the 12 clotting factors, including calcium and vitamin K. So here's a table presenting all the 12 clotting factors used or being used during the coagulation cascade. So um, there are other names for each factor. For instance, for factor 2, it's prothrombin. Factor 3 is either tissue factor or tissue thromboplastin. And according to the video, the most important factor for targeted therapy could be the factor 10 or the Stewart factor. The extrinsic pathway is said to be the quicker responding and more direct pathway for coagulation as compared to the intrinsic pathway. So, from the name itself, the cascade of protease reactions is initiated by factors that are outside the vascular system. It should begin with a traumatized vascular wall coming into contact with the blood. So once in contact, there will be release of tissue factor 3 or tissue thromboplastin. This factor actually acts as a proteolytic enzyme. So once the tissue factor complexes or makes a complex with factor 7 and calcium ions, it will cause the conversion of factor 10 to its activated form. So remember guys that once a factor or a clotting factor is activated, magkakaroon ng letter A after its Roman numeral form. So from factor 10, factor X, magiging factor XA siya. So this activated factor 10 will also make a complex with the tissue phospholipids along with factor 5. So again, at this point, the factor 5 is still inactivated. So once the complex of factor 10A, phospholipids, and factor 5 are grouped together, it will now be responsible for the formation of prothrombin activator. So initially, as I've mentioned, factor 5 is inactivated. But once the clotting begins and thrombin begins to form through the formation of prothrombin activator, the proteolytic action of thrombin will activate factor 5. So once factor 5 is activated, it actually helps or it actually accelerates the protease activity of um, thrombin. Okay, so para siyang positive feedback para more thrombin yung ma-form. So now that the prothrombin activator, once it is formed, it will now proceed to the common pathway. So the role of prothrombin activator, as I said, is to convert prothrombin into thrombin. In contrast with the extrinsic pathway, the intrinsic pathway is longer and more complex. So for this one, it begins with blood trauma or blood coming into contact with collagen. So what happens when blood comes into contact with collagen? So it will affect two clotting factors already. So number one, factor 12. So once factor 12 comes into contact with collagen or any negatively charged surface like a glass, it will have a new molecular configuration, making it activated. And then another thing is its effect on the platelet. So blood coming into contact with collagen will trigger the platelets to release its tissue factor or the tissue thromboplastin. So for the next step, the activated factor 12 makes a complex with high molecular weight kininogen with the help of prekallikrein. So the complex of those three substances, activated factor 12, high molecular weight kininogen, and prekallikrein, will enzymatically cleave factor 11 to make it activated. So once factor 11 is activated, it combines with the help of calcium ions. It combines with calcium to activate naman factor 9. So the activated factor 9 will um, act in concert with activated factor 7, platelet phospholipids, and the platelet factor 3 to activate factor 10. So this is where it will be similar to the last step of the extrinsic pathway, wherein the activated factor 10, with the help of calcium ions, will form the prothrombin activator. So the formation of the prothrombin activator is the last step or the step where extrinsic and intrinsic pathway will merge together to become the common pathway. So again, the role of prothrombin activator is to convert prothrombin into thrombin. So like in extrinsic pathway, the thrombin here that forms will help in the activation of factor 5. And then activated factor 5 will accelerate the conversion of prothrombin into thrombin, making it a positive feedback. So next. So let's talk about prothrombin activator. So again, this one converts prothrombin to thrombin. So prothrombin is actually a plasma protein formed by the liver. So yung thrombin na nanggagaling from prothrombin is very important for the coagulation cascade to proceed. So number one, what it does is that it removes low molecular weight peptides from fibrinogen, so that it will form one molecule of fibrin monomer. So with the help of calcium ions, each of those fibrin monomers will polymerize with each other to form fibrin fibers. But this one, yung fibrin fibers, it's not yet stable. That's why with the help of fibrin stabilizing factor, it will form covalent cross-linking with each other to form a mesh called the stable fibrin. So this fibrin stabilizing factor, if you can remember, it is inside the cytoplasm of the platelets. So remember, sa clot na meron dyang entrapped na platelets. So with the help of thrombin, ma-release the fibrin stabilizing factor, the thrombin will also activate it para mag-act upon sa fibrin fibers, yung fibrin stabilizing factor, so that it will help in the cross-covalent linking between the fibrin polymers para maging stable yung fibrin. So as you can see, thrombin acts at different steps in the coagulation para mag-cause siya ng positive feedback, para magtuloy-tuloy and mag-progress yung coagulation cascade natin. As the vessel heals, syempre, we have to restore the normal blood flow. So for that to happen, the clot must be removed. So when the clot is formed, a large amount of plasminogen is trapped in the clot along with other plasma proteins. So the gradual degradation of the clot is called fibrinolysis. So this one begins with conversion of the plasminogen trapped in the clot into plasmin. So the conversion is catalyzed by tissue type plasminogen activator or urokinase type plasminogen activator. The injured tissues kanina and the vascular endothelium, they slowly release the tissue plasminogen activator. And then, once the clot is fully formed and ready na ma-degrade, the tissue type plasminogen activator will now act on the plasminogen to convert it to plasmin. So, plasmin is a protease that can break down both fibrin and fibrinogen. So, it also digests fibrin fibers, clotting factors such as factor 5, factor 8, prothrombin, and factor 12. So, by doing that, it actually stops the coagulation cascade to proceed pa. Kasi nga, ready na tayo na alisin yung clot sa system. Ready na tayo na i-degrade siya. So it is said that the presence of fibrin actually accelerates the conversion of plasminogen to plasmin. So we've talked about the process of fibrinolysis, especially after the damaged vascular wall heals. So after that, our body needs to ensure that really the normal clot-free condition of the blood is restored. So for that to happen, dyan papasok yung anticoagulants natin. The anticoagulant or an anticoagulant is any substance that opposes coagulation. So, they play a role in limiting the coagulation process para nga ma-restore yung normal clot-free condition of the blood. So, the most important factors for clot prevention are, number one, the smoothness of the endothelial cell surface. Kasi remember guys, di ba, once nagkaroon ng break or once nagkaroon ng damage sa endothelial cell surface natin, the platelet will be attracted to it. The platelet will adhere to it, thereby proceeding na tayo sa coagulation cascade. So, magtutuloy-tuloy na naman siya, mangyayari yung 3A's, yung adhesion, activation, aggregation. So, kaya dapat may ensure na smooth na ulit yung endothelial cell surface natin. So, there should be the presence of glycocalyx kasi nga it helps to form the protection na hindi magkakaroon ng platelet adhesion. Then lastly, there should be the complex of thrombomodulin and thrombin because this complex will activate protein C, which acts as an anticoagulant. So, here are some examples of anticoagulants in our body. So, number one, we have prostacyclin. So, most of the anticoagulants actually are from endothelial cells itself. So, the prostacyclin promotes vasodilation. So, pag vasodilated, mas maganda yung flow ng blood. So, it will inhibit platelet activation and clotting. There's also nitric oxide, which will inhibit the platelet adhesion and aggregation. There is the tissue factor pathway inhibitor, or TFPI, which will block the protease activity of activated factor 7. Antithrombin 3, which inhibits the activated factor 10 and thrombin. Remember guys, the many important functions of thrombin sa coagulation cascade mo. So kapag na-inhibit mo siya, most of the steps sa coagulation cascade natin sa pag-form ng stable na fibrin fibers will be inhibited already. And then next, there is the thrombomodulin, which forms a complex with thrombin para nga matanggal to sa circulation. And then the protein C system with protein S because protein S acts as a cofactor sa function ng protein C that will inactivate clotting factors involved in the intrinsic pathway. And then we have heparin also, which will bind with antithrombin 3 to remove thrombin. So, kung makita nyo here, dami na gustong alisin si thrombin sa circulation para maging smooth ulit yung pag-flow ng blood. So heparin is actually used in clinical practice. So it's a short-acting anticoagulant. So it is its action is that it binds with antithrombin 3 to remove thrombin. So it also removes activated factors 9 to 12. Short-acting siya because its action usually lasts for about 1.5 to 4 hours only. So for clinical practice, it is used, kunyari, if magkakaroon ka ng major surgery like bypass surgery, meron kang pulmonary embolism, which we will talk about later. So, ginagamit yung heparin for that one. In this slide, we present some clinical scenarios that can occur from clotting disorders or coagulation failure. So number one is vitamin K deficiency. So almost all of our blood clotting factors are formed by the liver. And then some of these factors, they need vitamin K for its production. Namely the prothrombin, factor 7, 9, 10, and protein C. So, syempre, if you are vitamin K deficient, hindi mo perform properly these factors, so, masa-stop din talaga yung clotting cascade. So, vitamin K deficiency, one of the most prevalent causes of this one is the failure of the liver to secrete bile into the gastrointestinal tract. So, this will cause bleeding tendencies. But this one, it rarely occurs unless, yun nga, meron kang gastrointestinal tract problem or liver problem because vitamin K is produced by bacteria inside our gastrointestinal tract. So, normally, meron ka talagang supply of vitamin K. Vitamin K deficiency, it can happen. Mas madalas siya mangyari sa newborn babies. That's why upon birth, binibigyan ng vitamin K ang mga newborn babies to prevent bleeding. And then next is hemophilia. Hemophilia, on the other hand, is a genetic disorder that occurs almost exclusively in males. So 85% of cases is caused by an abnormal or deficient factor 8. So this is called classic hemophilia or hemophilia A. So for this one, bleeding usually does not occur except after a trauma. So wala siyang spontaneous bleeding na mangyayari unless yun nga, magkaroon ka ng trauma. And then last for this segment is thrombocytopenia. So thrombocytopenia is the presence of very low number of platelets. So normally, platelets, as mentioned kanina, it's about 150,000 to 300,000 units per microliter of blood. So anything below that is thrombocytopenia. So, bleeding caused by thrombocytopenia is usually from small venules or capillaries lang. So, that's why yung itsura nito, meron lang small punctate hemorrhages sa skin. It can be an idiopathic, meaning the cause is unknown. But it is implicated na baka there could be specific antibodies na nag-form and reacted against the platelets, causing destruction. In clinical practice, we usually see yung ITP, yung idiopathic thrombocytopenic purpura. I think I've encountered one with vaccine related. So the vaccine reacted, so with the body, nag-form ng specific antibodies and then destroyed the platelets. So that one. And then naman, if for the disorders of coagulation failure, it usually happens if we have naman excessive number of platelet known as thrombocytosis. So, pag madami kang platelets, yung kabaliktaran naman, there is a higher risk for excessive clot formation. So, this excessive clot formation is called thrombosis. So, a thrombus is an aggregate of platelet erythrocytes that are trapped within a mass of fibrin strands. So, depending on how big the thrombus is, of how much it can decrease the blood flow or block blood flow. So, kapag hindi ganoon kalaki, yung diameter nung thrombus and yung blood vessel also, pwedeng decrease lang yung blood flow. But if the thrombus is big enough that it gets stuck in a small vessel diameter blood vessel, it can totally block the flow of blood. As compared with comparing embolus from a thrombus, embolus naman is a portion of a thrombus na nag-break free siya from the vessel wall to enter the circulation. So, it can block vessels going to a major organ causing, for example, yun nga, pulmonary embolism. So, if carried kasi somewhere, if nadala through the bloodstream yung embolus, pwede siyang pumunta to other blood vessels and then block the blood flow to that blood vessel. For instance nga, blood going to the lungs. It gets blocked by an embolus. That's what we call pulmonary embolism. So, kung matandaan nyo, I mentioned kanina, the use of heparin as an anticoagulant for the treatment ng pulmonary embolism. So, the last clinical example is disseminated intravascular coagulation, or DIC. This one happens after large amounts of traumatized tissue release large amounts also of tissue factor in the blood, or factor 3, or tissue thromboplastin. So, nangyayari here is that na-activate mo yung clotting coagulation cascade, but small numerous clots yung magiging evident. So, nangyayari, these small clots will plug also the small peripheral vessels, causing decreased oxygen delivery to the body. So, this one is usually seen in patients with widespread septicemia. Kaya if you see your patient na may sepsis with DIC, you see the numerous small cuts in your body, matakot ka na because it might lead to septicemic shock. So, 85% of patients na nagkakaroon ng DIC, they go into septicemic shock because nga of the decreased delivery of oxygen to the body. However, a peculiar effect of DIC is that sometimes or occasionally patients begin to bleed. So the reason for this bleeding is that so many of the clotting factors are removed dahil nga nagtuloy-tuloy yung clotting cascade natin, that konting procoagulants na lang yung nag-remain sa body to allow the normal hemostasis of the blood. Kaya nagiging endpoint, nagkakaroon sila ng risk for bleeding tendencies. So for the last segment of this lecture, we will tackle a little bit of blood coagulation tests that we do in the clinics or in the lab. So number one is bleeding time. So bleeding time is actually a test performed to evaluate platelet function. Normal value is between 1 to 6 minutes. But this one kasi, it's variable. It depends, number one, on the depth of the wound na ginawa nyo and the degree of hyperemia also. So, the bleeding time is especially prolonged by the lack of platelets. Kaya it is used to evaluate platelet function. So this one we will do in our experiment. The next one is clotting time. So clotting time is the time required to form a clot. So the normal value is between 6 to 10 minutes. However, this test is no longer used in the lab because the time varies widely depending on the method used for measuring clotting time. That's why hindi na lang siya ginagamit. And the last one is prothrombin time, PT, and INR. INR is International Normalized Ratio. So PT is an indication of the concentration ng prothrombin in the blood. So, gaano kadaming the percentage of prothrombin in your blood. So, the prothrombin time is the time required for coagulation to take place. So, the shortness of time is, so, ibig sabihin, gaano ka short yung time. It is determined mainly by prothrombin concentration. So the normal value is 12 seconds. The results of prothrombin time may vary also, even in the same individual. Kaya, ginawa yung INR. It is used to standardize the measurements of prothrombin time. So, the normal value of INR is 0.9 to 1.3. So, pag mataas yung INR, if your INR level is high, it indicates na may high risk ka of bleeding. Whereas a low INR value suggests naman that you have a higher chance of having a clot. So, there. So, this one, yung mga coagulation tests natin, they are important you come, if a patient comes in with unexplained bleeding or um, makita nyo na meron siyang mga rashes that could be from bleeding problems. And if sometimes it is also used if a pure patient will undergo a major surgery, and then may history siya ng prolonged bleeding, kunyari after a tooth extraction. We usually do this blood coagulation tests to check if magkakaroon siya ng high risk of bleeding after a major surgery. So yun. But it's a case-to-case basis. Depends on the history of your patient if it's really indicated or not. So that's the last part. If thank you. If you have questions, you can post it sa discussion board sa Canvas or you can send me an email. So thank you for listening.